Bismillah ar-Rahman ar-Rahim. Today we are going to discuss the community environment and health, or environmental health. First of all, we have to define the environment. We can say the totality surrounding the human being, everything surrounding the human being is considered a part of his environment, as physical or biological or psychological. The totality of influences which infringe upon man and affect his well-being is his well-being as his environment. Or the disease arises when there is maladjustment of the individual with the environment. So we have to look for the environment comprise as physical environment, or biological environment, or psychological environment. In order to prevent the deleterious effect of these factors, which consider as the component of the environment, physical, biological, or psychological, we have to do some what we call environmental sanitation to prevent those factor from reaching the individual, or make the individual some types of regular functioning in order to tolerate such type of environmental factors. Now let us have a look to type of activities under environmental health, which consider those activities consider under the health, environmental health. Those activities includes: number one, control of air pollution, radiation, and noise. We have to control air pollution, radiation, and noise. Number two, housing and the immediate environment. Number three, urban and regional planning. Number four, accident prevention. 5, public recreation. 6, water supplies, water pollution and wastewater treatment. 7, solid waste management. And food hygiene and sanitation measures at times of the epidemics, disaster, emergencies, and migration. So those activities are control the environmental health, and we can, if we do those activities, we can prevent the human being from exposure to different hazards of environment. Now let us move to what do you mean by indicators, and what are the environmental indicators, مؤشرات البيئة. As regard to air pollution, those are toxic and irritant gases and fumes, as carbon monoxide and carbon dioxide. All of us know how much carbon monoxide affects the human being, and carbon dioxide, and ammonia, sulfur dioxide, halogens, nitrogen dioxide, and nitric acid oxide, hydrogen sulfide, 7, ozone. All these are considered as a toxic and irritant in the air irritant and toxic for the health of the human being. And what type of sources of air pollution? Either industrial, those indicators of air pollution from where comes to the human being, from industrial as combustion of coal, oil and other fuel, and also motor vehicle, more in urban areas, and last one the miscellaneous مسائل أخرى غير هذه اللي ذكرناها. So here we are discussing the air pollution as regard the toxic and irritant gas as regard to air pollution, as we have said, carbon monoxide, carbon dioxide, ammonia, sulfur dioxide and other. And what are the sources of these air pollutants? As we have said, industrial, combustion of coal, motor vehicle and other miscellaneous types. So the indicators of air pollution and air pollution level, those are very important as indicators, مؤشرات. Number one, sulfur dioxide. Sulfur dioxide also comes from the industries. Smoke index. Number three, suspended particles, carbon monoxide, oxidant, nitrogen oxide and lead. All these are indicator to indicate that there is an air pollution as regard to sulfur dioxide or smoke or suspended particles or carbon monoxide or nitrogen oxide and the other. If we consider those, we have to look for the concentration in air in order to prevent the deleterious effect to a human being. Now let us have a look to type of effects of air pollutions as follows. Number one, either immediate effects, and those are allergy, acute bronchitis and other respiratory disease. When any person exposed to certain air pollutant as gases and other, he develop allergy or acute bronchitis and other respiratory disease. Second, this is the immediate effect of air pollution. Number two, the delayed effect. The delayed effect as chronic bronchitis and primary lung cancer, heart disease, neurological and behavioral effect. Those type of diseases and abnormality of health, of human health, develop after a period of time after accumulated those air pollutant accumulated in the body and start again to affect the respiratory system as chronic bronchitis, causing chronic bronchitis, and the primary lung cancer as the other gases and irritant element. Also heart disease from the exposure to carbon dioxide and monoxide and other neurological and behavior effect which can affect the nervous system, central nervous system. Those we can consider them are not directly affect the orodental diseases. Also those type of environmental pollutants cannot immediate affect the orodental diseases, but indirectly it affects the development of joints and nasopharyngeal complex, thereby affecting the structures. That's mean we cannot consider the elements of air pollution are some sorts of immediate effect on the dental or orodental type, but they can consider as delayed effect elements.